everything that we loved about the quaint and small hospital that we had, we just moved over to just a more functional practice. What we've done is we've went from 2 exam rooms to 5. We've went from 1 surgical suite to 2. We've basically kind of taken the same concepts of a very one-on-one, very homey, very stress-free environment, and we've just put it into a larger facility. The fireplace and the rooms and how they're decorated, and the lavender in all of the rooms, just trying to keep this as calm and as peaceful as we can. It doesn't smell like a vet clinic. It doesn't look like a vet clinic. It basically looks like just another room in their home. We're right smack dab in kind of a very bustling type of shopping center with a lot of the big shops and food places that are around here. But with the added space, we've been able to add on the digital radiology. We've been able to take that to a new level where we're doing imaging that we hadn't been able to do before. We want to make sure that we have every technology available to make sure that we can do in-house laboratory and get laboratory results right away, that we could take an x-ray or do an ultrasound right away, and that we can give them results right away. That way we're not sending them to an emergency facility where, again, the pet has to get back into the car, drive a certain distance. The people have to go to a different doctor that they don't know. I think all the doctors here pride themselves on really having a very extensive medical and surgical base so that we don't have to do those referrals. Rehab has been a remarkable facet for our practice, with having animals that have sports-related injuries like cranial cruciate ligament ruptures, patella luxations, things like that. Just older dogs that have muscle atrophy just from osteoarthritis. We now have capabilities of doing physical training with them. We have a laser machine that helps to reduce the inflammation of that area, to kind of get them back on their feet quicker. Our doctors are very dedicated. We will double book ourselves because we know that it's important to get these patients in, get them seen, and get them on the mend fast. We do a very good job of making sure that we have that dialogue with the client about what their pet needs, and then we try to work very hard to ensure that we keep this environment in here, especially with the amount of staff that we have, the amount of interaction. If there is a fractious animal or an animal that just doesn't like other dogs, we have a separate entrance for them. So they don't even need to go through a waiting room. They don't even need to see another dog. We can put them to an entirely different entrance, again, just to alleviate some of their stress. We're all really great doctors. We're all really good techs and assistants. We're all really good receptionists. We're all really good people. But at the basis of that has to be not only a compassion for animals, but also to people as well. Not every patient is the same. Not every family is the same. Not every case is the same. So we want to be able to take a very multi-module kind of approach and be able to give our clients not only the best care, but tons of different options. We'd really strive to be very cost conscious. I think even if we were in that smaller environment, it wouldn't matter to them, because I really think down deep it just matters the type of service that they're getting from us.